Joining us now, Dr. Robert Murphy, professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
So with Pfizer winning full government approval, do you think that will make a difference in getting more people vaccinated?
I think it's going to remove one more barrier from the people that are hesitant to take the vaccine, so that's great. It's great news. It's about a year after the clinical trials were done. There's plenty of safety data and hundreds of millions of people, and full approval is certainly worthy. So I hope it makes a difference, and I think it will.
Let's talk about these boosters. There's something to be learned about the effectiveness of them if we look at what happened in Israel.
Yeah, Robin, Israel was the first country to really get the most people vaccinated. You know, it's a relatively small country. Everybody got the same vaccine. They all got pretty much, they all got the Pfizer vaccine. And, you know, they showed that dramatic benefit in decreasing hospitalizations and death right away. And they were also, because they're ahead of everybody else, they showed that, you know, older people over 60 years of age and those with immunocompromised conditions start breaking through the two-dose vaccine. And they started the third dose a while ago. And sure enough, they report there's a 5 to 6-fold decrease in hospitalizations now after that third dose for the vaccinated people.
Many school districts back in school, some are starting today. Where are we with getting the shot for kids under the age of 12?
Yeah, no, that's a good question, Dan. You know, the study has to be evaluated. They have been saying, you know, the rumor mill that that data will be available and evaluable in September for that next group of people, and by the end of the year, for actually down to 6 months of age.
All right, let's get to some viewer questions. Can the COVID-19 shot, Pfizer or Moderna, be combined at our local pharmacy with the flu shot?
Technically, yes. Actually, on the 19th of August, CDC released new guidelines. Said, you know, you don't have to wait the 14 days between the boosts. Some people do like to wait. Some doctors like to wait with their patients. So it's really still an individual decision. But from a technical standpoint, you don't have to wait. The side effects can overlap, though. So you don't know which vaccine, you know, could have caused a little fever or whatever. But the vaccines will work. And most people will do just fine, but it's a personal decision. Doesn't matter if you wait or if you take them at the same time.
Next question. The CDC says if you are exposed to someone that is positive and you are vaccinated, to wait 3 to 5 days to get tested. If you test before 3 days, is there a large percentage of people that get a false negative?
Yeah, almost 100%. So it's quite a large percentage. It takes a while for the infection to really set in, get in place, start replicating, and the test will turn positive. So you have to wait the 3 days.
All right, last question. Now that a booster is being recommended due to vaccine effectiveness decreasing, will people past the 8-month mark still be considered fully vaccinated if they do not get the booster?
Yeah, this is a very sophisticated question, and the answer is yes. You know, you have to have all your vaccines with boosters. You know, we would consider that the appropriate way to measure. It'll be a little bit challenging trying to figure out all the fully vaccinated. It's totally doable. But remember, you know, we're talking about hundreds of millions of people getting vaccinated. But yes, that's correct. Fully vaccinated will include the booster.
All right, Dr. Murphy, thanks for being with us. If you didn't get your question answered by the doctor, he answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our Morning News Facebook page and post one there. We'll talk to him again on Friday. Thanks.
Great. Have a great
good
week.
day.